Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. On January 10th, 2022, three vitamin D experts met for a panel discussion to provide an update on vitamin D as it impacts aspects of human health. Now, one of the topics covered was the influence of vitamin D in protecting us against COVID-19 infection, morbidity, and mortality. So the panel moderator was Dr. Pam Taub, a cardiologist and professor of medicine at the University of California, San Diego. And one of the panelists was a personal hero of mine, Dr. Michael Holick, a professor of medicine at Boston University. He was the first researcher to identify the major circulating form of vitamin D in the blood. Over the past 4 decades, he's led many of the studies demonstrating the benefits of vitamin D, and he's responsible for bringing vitamin D, putting it on the radar of health professionals. A lot of the things that we know about vitamin D and sort of the public awareness that we have is because of Dr. Michael Holick, actually. He's published a lot of very important papers. The other panelist was Dr. Joanne Manson, another luminary in the field of vitamin D research and a professor of medicine at Harvard Medical School. She's been involved in many landmark clinical trials that have changed clinical practice for doctors, including the Nurses' Health Study, the Women's Health Initiative Study, and the more recent vitamin D and omega-3 trial known as the VITAL Study. So these are really top-level individuals in terms of vitamin D knowledge. So the moderator, Dr. Pam Taub, made this statement and posed this question to the two panelists. There's a large amount of data that shows low vitamin D levels are associated with patients who have more complications from COVID-19 and are in the ICU. What are your thoughts on supplementation with vitamin D for everyone? Because we all want to have fewer complications if we acquire COVID-19. So part of Dr. Holick's reply included this, and I quote, "We initiated studies almost immediately after the pandemic began. We worked with Quest Diagnostics and we looked at more than 191,000 COVID-19 positive patients throughout all 50 states, all ages, ethnicities, latitudes, and we showed that if you have a blood level of vitamin D that is at or above 50 nanomoles per liter compared to, if you had a blood vitamin D level that was at 50 nanomoles per liter compared to a blood level at 85 nanomoles per liter, you had a 54% higher risk of acquiring the infection. So lower vitamin D levels made you more susceptible to acquiring COVID-19. We know that vitamin D does have an important role to play in immune modulation. This is what he says, and that COVID-19 infection causes the cytokine storm. The thinking is that the active form of vitamin D can help to down-regulate cytokines that are damaging and improve cytokines that can help. So he's saying if you have more vitamin D circulating, it helps to contain the cytokine storm so it doesn't become a life-threatening outcome for you. He said, we've done a couple of studies. The first was in Iran and included more than 200 patients coming into the hospital, including 74% with serious infection. When we looked at their baseline blood levels of vitamin D and their outcomes, there was a significant decrease in morbidity and mortality. In fact, among those over age of 40, there was more than a 50% reduced risk of dying from COVID-19 infection simply by being more vitamin D sufficient the time that you enter the hospital, not after you get into the hospital, but leading up to the time you get to the hospital in your everyday life. Are you vitamin D sufficient? If you are and you get COVID-19 infections, the outcomes are better. What he said is we did a study at Boston Medical Center and looked at patients coming to the hospital. We got their baseline blood level and then followed them for morbidity and mortality. And again, it showed very significant differences. Those who were deficient had more significant morbidity and mortality from COVID-19. We do believe that improving vitamin D status throughout your life can help reduce the risk of infections and COVID-19 infection. More importantly, patients going into the hospital, if nothing else, should be treated with vitamin D almost immediately upon the diagnosis being made. So he cites a research paper to support that. He says there are many biological mechanisms that have been shown for vitamin D to be important in boosting immune response, as well as tamping down inflammation and immune modulation, which are mechanisms that are very relevant to preventing severe COVID-19 infection. So in other words, vitamin D is helping the immune system respond in a way that can fight the infection, but not creating an over-response or secreting too many cytokines that will actually create morbidity and mortality. So then Dr. Manson chimed in with the following statement. She said, during a pandemic, if anything, we want to err on the side of encouraging more intake of vitamin D because we think it's a very safe thing to do. One of the lessons from the VITAL study was that 2,000 IUs per day was virtually free of adverse events as we followed people over more than 5 years. It had a very good safety profile. During a pandemic, why not recommend that everyone ensure that they're outdoors getting sun exposure, being physically active, as well as maybe taking a supplement of 1,000 to 2,000 IUs a day. I think that's quite reasonable, she says. We're doing a trial right now called the Vitamin D for COVID-19 trial. We're in the process of recruiting with several hundred people enrolled already in the study, and we hope to have some results very soon. So we're looking at vitamin D supplementation started right after the diagnosis, where they're giving high-dose supplementation to people who are diagnosed with COVID-19 arriving at the hospital, where they give them 10,000 IUs for the first 2 days as a loading dose, then 3,200 IUs of vitamin D every day for the next 4 weeks. So they're waiting to see what the results will be from that trial, but they should be in soon. We're looking to see whether that will reduce severity of symptoms, risk of hospitalization, need for healthcare visits, and outcomes of that nature. We hope to have the results by the end of the year or soon thereafter. She says, but I do agree that recommendations should go out to the general public right now to avoid vitamin D deficiency at all times, but particularly during pandemic when there's promising evidence for vitamin D being of benefit. Dr. Holland says, I certainly think that following the Endocrine Society practice guidelines is reasonable. They recommend for all adults 1,500 to 2,000 IUs of vitamin D a day from supplementation. And they recognize that if you're obese and you have more body fat, vitamin D is going to be stored more in your body fat. It's hard to get your blood levels higher. He's saying you're going to need to take 2 or 3 times that dose to get the circulating blood levels that are ideal, which would be above 85 nanomoles per liter. He said, for my patients, I typically have them on 3,000 to 5,000 IUs a day. For children, he recommends 600 to 1,000 IUs a day. He thinks that's appropriate. For teenagers, he says, I think that they should be on 1,500 to 2,000 IUs a day of vitamin D. He said that he personally takes 6,000 IUs of vitamin D a day, and his blood level of vitamin D is at 180 nanomoles per liter. He says, I like for my patients, though, to be in the preferred range from the Endocrine Society, which is between 100 and 150 nanomoles per liter, which I think is correct. And he says, I allow them up to 100, up to 250 nanomoles per liter, saying that that's perfectly safe. But I will tell you this, from the studies that have been reported, that I'm not talking about here, I would caution you about having your vitamin D levels go too high. As various studies have shown that having a blood vitamin D level above 140 or 150 nanomoles per liter actually weakens the part of your immune system that allows your immune system to make antibodies, the adaptive immune system. It actually makes you more prone to not only infections but severity. So it appears that Dr. Manson agrees with me when I say that. In her follow-up statement, she said, I would say that the recommendations need to vary according to the health status of the person. I agree with that. During this pandemic, I would err on the side of recommending more vitamin D. Currently, I would recommend on a population-wide basis 1,000 to 2,000 IUs a day. And I really do agree with Dr. Manson because 1,000 to 2,000 IUs a day for most people will get them between 85 and 140 nanomoles per liter. And that supports your immune system in a way that helps to reduce risk of infection and keeps your immune system able to fight infection. Once you go beyond 140 nanomoles per liter in your bloodstream of vitamin D, it actually sort of pulls back the adaptive immune system so you can't make antibodies that well. And you need that to fight an infection. Now, if a person has autoimmune disease, then going above 140 nanomoles per liter sometimes makes sense because sometimes the immune system is going haywire and attacking the body's own body tissue, so you want to pull it back. So the sweet spot really seems to be between 85 and 140 nanomoles per liter. So to sum up, the vitamin D experts seem to agree that more optimal vitamin D status can help to prevent COVID-19 infection, reduce its severity, and reduce risk of dying from this infection. More studies are being conducted, but it seems prudent to maintain a blood level of vitamin D between 85 and 140 nanomoles per liter. In the United States, that would be between 30 and 52 nanograms per milliliter, which usually entails supplementing 1,000 to 2,000 IUs per day of vitamin D. Some individuals need higher amounts to achieve this blood level. The best thing you can do is to see your doctor, see what your blood vitamin D level actually is, and then with your health practitioner decide how much vitamin D makes sense in your case to get your blood into the range of between 85 and 140 nanomoles per liter, or 30 to 52 nanograms per milliliter. So I hope this was helpful. You can see that experts, the leading experts around the world of vitamin D are saying if your vitamin D status is where it ought to be, your risk of infection is lower, your risk of complications is lower, and your risk of dying is 50% lower. That's the evidence that we have so far. So vitamin D is an important part of the study. I hope this was helpful. I've included the reference for the panel discussion in the text below, and I will see you next time. Thank you.